I'm Reisa Marlowe, and this is Reisa's Rockin' the Spa. It is Wednesday. Every day feels like the same day, doesn't it? It's the strangest thing lately, but I don't know. Just every day I sort of pick a day that it feels like, and then I have to sort of check and make sure I actually have the right day. So today is Wednesday. I'm pretty sure of that. And tonight, my guest is a veterinarian. She's an emergency room veterinarian, and her name is Jenny Odell. Welcome, Jenny.
Thank you. Thanks.
So glad to have you here.
Thank you.
That's great. And my dogs came over. I think they heard, they're like, "Oh, Jenny's on the screen. let's go over there and check it out." I may actually show you one or another if they actually let me pick them up. You've never met them, right? No, wait. This is Ginger.
Ginger.
Ginger had a very serious haircut. She's like, "Ooh, that lipstick shade. I love it."
Let me try that out.
Ginger, that's Jenny. Ginger had a severe haircut after COVID because her hair became so matted, even though I was trying to brush her all the time. And I gave her 2 baths because, she became a stinky dog.
Yeah.
But then, and I don't think she wants to go down.
No. This is where she is now.
Happy. Boo is here
happy.
now. Boo, you want to come up too? He's going to run away. Okay, we'll see if she stays here. Up to you, Ginger. So, we got another one. Okay, let's see. This is the other one.
Oh, a Boo. Hi, a Boo.
This is a Boo. And a Boo's like, "Get me out of here. I don't want to be on camera."
He's done.
Okay.
He's done too.
Okay, so now that you've met my dogs.
Yeah. I'm so glad you didn't try to give them haircuts at home.
That's like people giving themselves their own haircuts and then giving their dogs the same
Right, except
haircuts.
That you cut your dog and then you have to come see me.
Yeah, no, that's really not good. So I am so interested actually in asking you about your experience during COVID. I understand that were many of the regular vets offices closed, or was it some vets offices were closed?
I think it was just some. I don't actually know officially who was closed and who wasn't. It was more of like speaking to clients and them saying, "Oh, my vet's closed for this amount of time," or they're only seeing specific types of cases or whatever it was.
Yeah.
And so it was only word of mouth. I don't really know kind of how everyone handled it.
Yeah, got it. So, but I understand that you had you saw a lot more patients than you normally did.
Definitely. Yeah, I think we had the highest numbers that we've ever had in the emergency room during COVID. Yeah.
What was that like?
Yeah. It was hard. It still is hard, honestly. It's not an easy situation to be in because, of course, as a vet, you want to see all the patients. You want to give everyone the appropriate amount of time that they deserve and attention to the case and the best medicine that you can do for them. But a lot of times you're so stretched thin with how busy it is and how many truly emergent cases are coming in between the urgent or maybe not so urgent cases that they still should be seen at some point, but aren't able to be given that appropriate amount of attention in between all of the truly emergent and urgent cases too. So,
wow,
it's very overwhelming.
Are people? I bet. So, are people able to come in with their pets, or it's no. I think the office. Right. So you're dropping the animals off, and is that easier or is that harder?
There's pros and cons to it. I think that it's easier for us in the sense that we have a little bit more control over things getting not necessarily lost in the shuffle. Like something urgent, emergent comes in, we can see it right away. We can look at it right away. It's right in the ICU with us. But other times, people are in their cars, they're waiting. It's a long time. They get, frustrated and tired and hungry and all of those things. So it's just, it's a lot.
I
So,
would think that the triage is very hard, like determining
yes.
with more, right, with more patients,
Hmm.
figuring out like who goes first and those
Right.
people who are not, right? So,
Exactly.
so not an emergency are getting pushed right to the back. And so
Yep.
do you find, are people understanding of this, or is this difficult?
I think
Yeah,
I would love to say yes, totally, but no, that's not the case. A lot of people do get pretty upset depending on the situation. And we try to be pretty open and honest with what we expect for wait times.
sure.
But obviously we can only give you an estimate, and that can easily change. And I think that's what upsets people the most is, yes, you're next or whatever, but if it's
Right.
a true stat comes in and needs our attention, then you're going to be pushed again. And that can easily happen while you're waiting. So it can add up. And I think that really frustrates people, and they don't necessarily see that. They're not able to put their eyes on it or understand how much time it takes, how many people it takes. So they just think, okay, I just got pushed again. And it's hard to manage everybody's expectations without
Sure.
without misunderstandings, I guess.
Yeah. And so, I mean, do you have any suggestions for people, who are coming to a facility like yours and they don't necessarily have an emergency? It might be urgent, or in their minds it's urgent, right? Because especially if you're a new pet owner, a lot of times
Sure.
something happens and you
Yep.
think it's an emergency,
Right.
and it may not
It's
really
not, right. It's an emergency to you, which we totally understand. And as a pet owner myself, everybody, they want their pet seen, they want to make sure that they're okay, but they're not necessarily as emergent as someone else. So if everybody could just practice a little bit more patience and kindness, I think that's the most important thing. Just understand that we're here to help you, obviously, but if you're not getting rushed to the back, that's a good thing. That's the most important thing. And if your dog is lame or has an ear infection or something wrong, an eye or something like that, like bring a snack, bring a book, I don't know, just make sure that you understand that it could be a wait. And we want to see everyone. We really want to be able to see everybody. It's just that it doesn't always work out for everyone in an appropriate, timely fashion. And we do our best to accommodate, but obviously that has...
Now, in terms of how many people there are, have new people been brought in? Are there more doctors now to deal with the more patients, or is it pretty much the same amount of people trying to deal with?
It's the same amount of people trying to see, yeah, and that's
very
the hard part. Yeah,
That's very hard.
right.
Yeah,
Right.
that's really difficult.
Yeah, and it's, for a while when we had a slowdown of our specialty doctors' patients, their appointments were kind of slowed down and spread out. They were trying to help us with some of the backlog of ER patients and things like that, but they're now back to their normal appointment schedule. So it's even less doctors seeing emergent cases. So,
yeah, I thought of something like, what, is there sort of a breakdown of like, when should you go to an when should you go to an emergency room with your pet? And, is there some sort of, if the pet is doing this, that, or the other thing, that if that's happening, you should be coming into an emergency room?
I mean, there's that's broad strokes, I guess. I guess difficulty breathing, seizure activity, collapse, things like that are going to be the most obvious reasons to bring your pet in. Obvious trauma, obviously. But it's hard to be as specific for that for people without knowing, necessarily what happened or what's going on.
Sure. Yeah. And sometimes it's really hard as a pet owner to know, for example, my daughter has, she's got a puppy, and they went to the shore, and the puppy was drinking, I guess, licking seawater.
Yep.
And at some point, barfed, a whole bunch.
Yeah.
And then, Gabby checked it out, and she realized, it can be dangerous, blah, blah, blah.
Yep.
So, maybe you could name a few things that are really dangerous to dogs that people might not know about. Like, I believe chocolate is, correct? Coffee.
Chocolate, yep. Chocolate, coffee, grapes or raisins.
Grapes.
Hmm.
Why? Or do you know?
It can cause acute kidney failure in
Wow.
dogs. And
Wow.
we don't know the mechanism for that, unfortunately. So we've had cases where, a dog ingests 2 grapes and goes into renal failure, kidney failure.
Wow.
And we've had dogs ingest a ton and they do fine. So we don't have enough information on the mechanism behind grape toxicity yet, but we know
Wow.
how bad it can be. So we always have
Right.
to err on the side of caution for everyone. So
Right.
that's a big one. That's a big one for, that's one a lot of times people are like, I didn't realize, or there are raisins in that trail mix and I didn't even think about it. And then they realize. So that's a big thing.
Yeah. What about ice? I think, is ice a problem?
I mean, it can cause damage to the teeth.
Oh, okay.
And certainly eating, like Gabby had been through, like there can be true water toxicities where their electrolytes kind of go out of balance, out of whack if they they're drinking, ingesting too much, but otherwise
Okay.
not so much. But
Okay.
pizza dough, like any raw dough, can be really dangerous.
Really? So
Mhm.
what about if it's cooked?
If it's cooked dough, not so much, but if it's raw dough, it can rise and expand in their stomach.
Oh, wow.
So.
Because Ginger likes pizza dough.
She can eat it if it's cooked.
It's
not
really
too much.
weird. Bagels.
Yeah.
Yeah.
She's a girl after my own heart. I love carbs.
Me too. Totally. She and I, we
Yeah.
just, if we're down or something, we sit down and have a couple slices of pizza or pizza bagel, right? Yeah.
Right.
So
there you go.
Right. So, when I was a little girl, I wanted to be a vet, right? I mean, I literally found things, I wrote it down. Like I wanted to be a veterinarian, I wanted to take care of sick animals and, So when did what happened for you? Did you always want to be a veterinarian? How did this happen?
So it was something it was on my list too, but I had a list of other things that I wanted to do as well. And I definitely loved the idea of helping animals and, that whole, I don't know if you ever read James Harriet, but that was definitely, he was kind of one of my idols as a kid once I read his books, which are not small. So if you ever get into those, they're pretty dense books. But then I didn't know if it was something that I could handle, honestly. Once I started to learn more about the profession as I got older, I was like, man, I don't know if that's something emotionally I could do, that I could be a part of, that I could really flourish in, I guess, without some of the sadness and kind of the drawbacks that come along with it. So it was something that I kept in mind, and I eventually got a job at a general practice as a kennel assistant, and then went to undergrad, and then came out of undergrad, and I was like, you know what, this is what makes the most sense for me. And I had tracked for biology just to make sure, because I really did think that's what I wanted to do, but I wasn't sure. And so then I came out and I decided to get some more kind of real life experience. So I got a job at the practice that I work at now, as a surgical assistant, and worked there for a couple of years. And then I applied to vet school from there.
So you had a good amount of experience under your belt.
Yes.
Before you actually went to school to know,
yeah.
Yes, I can acclimate myself to this, and
Yeah. I mean, I don't think you ever understand till you're actually in it, honestly. I don't think
that's
you
probably
ever
true
understand.
everything. Probably true for any, right?
Yeah.
Anything that you're going to do in life, it's until you're actually there. So how was that for you? How is it dealing with, whether it's, putting somebody's dog down or whatever, having to tell someone, that this is really not a good situation or what have you? I mean, what is that like?
It's not easy.
Yeah.
It's not an easy thing to have to explain. And I don't think there's any amount of classes or experience or continuing education or anything that anybody can ever talk to you about that really prepares you for that until you're in it. And most of the vets that I like, it breaks your heart just a little bit every single time you have to tell somebody news like that. It's never something that you don't feel for them for, I guess. You don't ever feel disconnected from that. And I think that's what's really hard. I think that's what's such a struggle for veterinarians as a whole, is we all went into this profession because of our love of animals, regardless of whether it's, you know, small animals, large animals, exotics, whatever it is that you do, you have a passion for it. And having to tell someone that, or having been through it yourself with your own pets, it's just, you come back to those emotions, and it's not easy. And it's definitely probably a huge reason why depression and suicide are such a huge factor in vet medicine. It's a huge issue.
Is it really? Wow.
Oh yeah. Mm-hmm. Yes.
Huh. I didn't know that. So I think, you know, I don't think that a lot of people know these things, you know, that it's sort of not general knowledge. And it really is, I think, such a very hard thing. And you do go in, I would imagine you do go into it, most of the people, because you have a predisposed sort of, you know, love for it, right?
Well, I mean, like you said, all kids, you know, or most of them anyway, love animals, and they all want to be vets because you want to cure the sick animals, but
right.
You can't cure all of them. And unfortunately, it happens more often than not. And that's really hard. And as hard as it is for the pet owners and the pet families, it's something that we struggle with too, because I would love to cure everyone and save everyone.
Yeah. But you know what, I think that, you know, when I listen to you speak about it, your compassion and the warmth that you feel, I would imagine that your patients' parents can feel that too. You know what I mean? Like realize that.
I mean, that's the goal.
Yeah. That, you know, it's a bedside manner thing, maybe, you know, I don't know.
Yeah.
So that you can feel compassion for them and understand, you know, how distraught that they are, right?
Sure. Yeah. I mean,
is there like outreach within the community for veterinarians in terms of?
There has been a big upswing in kind of trying to decrease that stigma with the mental health, and now there are a lot of really good resources for vets who are experiencing that depression, even just like online. Like I'm a part of a lot of Facebook groups even that are just, I mean, there's some that are there just for you to vent. Like, hey, I had this terrible case and it went poorly and the people didn't understand, you know, just to kind of get it off your chest.
Yes.
And then if you're really experiencing real, you know what, hey, I've been struggling for the past few months and it's not going away, I think I need real professional help, there's that too. And there's a lot of good resources out there, and I can send you the links for that if you.
Yeah, that'd be great. Yeah. That'd be great. Yeah. Sure. Thank you. It seems to me, you know, that more and more I hear of dogs passing from cancer or having cancer. Is that something that has sort of exploded, or was it always there and just maybe not detected?
I think it's always there. I think it's always been there. And I think it's something that we've just gotten to the point where we know so much more about it that now we can put a name on things that we couldn't put a name on before. And cancer has really become, like the oncologist at my job would say, it's treat it like a chronic disease rather than something that they're, you know, that's something necessary. I mean, unfortunately, we don't have anything really truly that can completely cure them, depending on what kind of cancer it is. But she's a wonderful doctor, and she treats these guys like, you know, it's like a diabetes, or, you know, something that they can live with, and we can try and manage until we can't manage it anymore.
That's phenomenal.
Yeah.
I think that's helpful for people to know, even because, you know, it's not necessarily like a sentence, you know, like
Right.
it's the end, like this, you
Right.
know, the C word, and then it's the
Yep.
end. So
Right.
I think that that's really helpful for people to know, because maybe a lot of people don't know that it's
Yeah.
available.
Sure. Yeah.
You know,
And sometimes it is, unfortunately, but you know, there are a lot more
same for
options than
people.
there used to be. Yeah, exactly. Yep.
Yeah. I was asking you about when we last spoke. I was asking you about bunnies, and I thought that that was really interesting. That many vets don't necessarily treat. Is that funny? Don't treat bunnies.
Well, and it's not. So I worked at a clinic a few years ago, that one of the doctors was extremely allergic, anaphylactic allergic.
Oh wow.
And so we couldn't, yeah. And so he couldn't have anything to do with them.
Yeah.
And then otherwise, I think it's just comes from not having the like daily exposure to them. So depending on where you live, it really depends on what people are trying to do, because you know, you grow up in a rural area and rabbits are used for meat. Unfortunately, they're livestock essentially, and then there's people who have pets, and so it kind of like is the spectrum. And so, you know, you don't necessarily have like a bunny vet per se, but you have people, you know, vets who will see a bunny or see whoever, and as long as they feel comfortable with it. But I guess I don't think everybody realizes how complicated it can be to see a patient that you don't necessarily see all the time. Like, you have that knowledge from vet school, but if you're not seeing bunnies every day, it can be a lot for someone to bring their bunny and be like, you know what, he's sick, but I don't necessarily know what's wrong with him. And that can be difficult for that practitioner to guide them as best as they would like. And so I think that a lot of times we prefer, you know, somebody who sees bunnies or does, you know, pocket pets on a daily basis, that kind of thing. Especially with all of the stress that goes into having them as pets too. Like, rabbits are pretty delicate, birds, very delicate. And so just, you know, bringing them to the vet can be really a stressful experience. The restraint that's necessary to examine them, things like that. There's a lot that goes into it that I don't think people necessarily realize, and they get upset because you won't see them, but it's not necessarily because you don't want to, but sometimes you don't want to make things, you know, worse or more stressful on the patient if they can be seen by, so
sure. I think it's just that, you know, when you're confronted with a problem, you're like, anybody please help, right? It's not like you're just going like, somebody come down
person
and
on
help
the side
me,
of the room.
right?
Somebody just help me.
Exactly. So you
I
know,
get that.
So I think that, you know, when the general population thinks of a veterinarian, unfortunately, I think we think of a doctor who treats all animals.
Right.
What I mean is like,
yeah.
Because I think
technically, technically you can. That's what we study our boards for, and it's just that you go to an ER and you have, you know, something more serious wrong with your hand. You're like, okay, cool, ER doctor, thanks so much for helping me right now, but I need to go see my hand doctor now because I want to make sure that. Right. Does that make sense? You want somebody more specialized to make sure that you're covering all the bases. They see hands every day. They're the specialists. Like, this is your hands. It's not. And so I think that's the hard part of explaining that to people, is it's not that you don't want to help them or help their pet necessarily. And if they're okay with that, that's fine. And then they can move on and see, you know, the bunny doctor when they can. But it's just, in the interim, people, I guess, have to be a little bit more understanding or lenient in the fact that we can help you if it's an urgent type of situation, and then you should probably follow up with someone who's practiced a lot more bunnies.
Sure. You know, it just occurred to me that with humans, you know, human doctors, all their patients are humans. So basically the systems all function the same way, right? But with
Exactly.
animals,
Yep.
that is not the case, right?
It's really not. No,
Yeah.
definitely.
So
Yeah.
like where
Mhm.
dogs are allergic, dogs can't, chocolate is poisonous to dogs. We eat chocolate, we're fine. Other animals can eat poisons that we can't. And that's just the way it is. You know what I mean? So with each animal, you're sort of dealing with a different set of parameters, right? Rather than with
Yeah.
humans, where we sort of have the same parameters.
You have that same baseline, you have that same knowledge about the regardless of what's going on.
Yeah, that's got to be pretty difficult, because I never thought of it that way. And maybe if people think of that, maybe that each animal, each species, right, has different things that how their systems work. And
Right.
so you can't expect one individual to be able to deal with all of that.
Right. Yeah. Yep.
Yeah. So do you sort of see more of one thing than another, or is it always sort of a mixed bag of what you see on any particular, evening or day or whatever?
It's pretty much a bag.
There's something else I really have wanted to ask you about, and that's, Ginger's been here the whole time with me.
Ginger. Hey, Ginger.
She's just been, right? She's just been there the whole time with me. So, I wanted to ask you this thing that, the dogs seem to be like very connected with how I'm feeling and what's going on with me. And so as a veterinary professional, that I'm just a layman with my dogs, right? Thinking like they're tuned in to me. If I don't feel good, they're kind of very good and whatever. So how do you feel about that?
I think that they definitely feed off of our emotions for sure. I think that you're close to your pets, you have that kind of bond. I don't know if it's, I think some people would argue, no, it's not emotions necessarily because we don't have any, but there's some connection that we have, whether it's, whatever you want to call it. There's some sort of vibration or, whatever it is that, you're stressed out. Right, exactly. And so I think that there's a lot of truth to that. Honestly, I do. And maybe we oversimplify that by saying that it's emotional or whatever it is, but I definitely agree that, when you're not feeling well or you're just feeling down, I feel like your dog will oftentimes, just chill out with you and relax with you and kind of gets that. But
right. And like they have those the animals that they bring into hospitals and nursing homes and such, and those animals, will go and hang out with people, and service dogs, they're amazing what they do.
Yeah,
and
great dogs. Yeah,
you have to think that that there's some part of them that is, it does seem to me like it can't all be in the training, that some of it is the animal is participating.
Right. Yeah, and I agree with that. And I there has to be some of it that isn't just, it's just a part of who they are, and they want to be there. It's not something that they really turn off necessarily when they leave. So
yeah. So
I
what's your favorite part of your job? What's your favorite part?
Rubbing the bellies of all my doggo friends. Seriously, I was just talking about this with one of my colleagues actually. I was like, if I could be like the soother, like where I could just walk around to all the hospitalized patients and spend time with them and snuggle them and, rub their bellies and give them little scritches and, just kind of hang out with them and spend time with them. That's, that's not necessarily a part of what they need as far as treatments go, but I can just spend some quality time with them and
Dog's best friend. right?
Yes,
Like
exactly.
man's best friend, you could be like dog's best friend. It's like, you know,
Yes.
you're the
The
comfort
soother,
giver.
the
Yes.
hospital soother. Yes.
Soother.
Yeah.
Yes.
Yeah. So I mean,
Chief
I
soother.
love, you know, meeting all my patients and stuff, but I like the non-medical aspect of things. I like bonding with them a little bit when they come in, and just, you know, even the scared ones, it's nice to, like, you know, okay, come hang out with me. I'm going to type up this little paperwork. You can sit next to me while I'm typing your discharge or whatever it is. And just having that little short connection with them, you know, and it's just nice. I love all my patients, obviously, but it's nice to have that little connection with them. And when they're hospitalized and I get to see them get better and get to snuggle them, that's my favorite part.
That's really wonderful. I love that. And it's so good. I just feel like, you know, going in your arms and
I love
my
to,
belly scratched. I'm kind of
Yeah.
ticklish there, but other than that, I think that's great. I think it's really, I would imagine that your patients really are happy for that, because, you know, you're scared when you're in the hospital.
Right.
You know?
Exactly. Yep.
I know I've been.
Right. Exactly. And you can't explain it to them. They don't know why they're there. You hope that when they start to feel better, that maybe they make that connection, that they're feeling better because of what you're doing. But, you know, who knows, unfortunately. But if I can give them a little rub and, you know, make them a little bit more comfortable, then yeah, that's my favorite part.
I like that. That's wonderful. Hey, I just want to thank you so much for coming on and being my guest.
Of course, yeah.
I really enjoyed this. I know I'm always in awe, really, of what you do, because, like what you're saying, it's not like a patient that's a human patient where you can say, like, does it hurt here? Does it, you know what I mean? Like, where does it hurt the most?
Just sit still.
Right.
While I stab you.
You know? So
Yeah.
I think that's, you know, that's a very difficult thing. Plus, you know, then you have to deal with the animal's parent, you know, who's also having a difficult time. So I think it's a tough, you know, it's a tough position to be in. It's a tough job to have. And I think a lot of people have this idea that, oh, you know, the vet just makes everybody better and like gives dogs lollipops and everybody's happy. And
I wish.
don't really realize just how difficult a job that is to sort of balance everything and keep everybody happy, right?
Right. Yeah, I wish that there was a way to make pet owners understand a little bit better than just kind of saying it, but I guess, like, you know, getting it more out in the open and letting people know that, you know, it's hard on us too, and we're there for their pets and we want the best for everybody. And so hopefully they can take that with a little bit of, you know, bring a little bit more patience and understanding of us too, and understand that we do care about everybody involved in the situation, and we want the best for everyone. And it's hard, you know, when we do have to
very
give,
difficult.
you know.
Yes. So hopefully we can get that info out to people who are watching, is to, you know, have some patience with your veterinarian and veterinary center, that, you know, they're doing the best that they can to see everybody and treat everybody in a reasonable amount of time. Right. And they sort of have to delegate, you know, who's most important in this very moment. Right.
Right. So, right. Yep. Yeah.
So thank you very much. I really appreciate your being here.
Thank you.
Love talking to you.
Me.
Night.
Take care. Bye. Bye, Abu and Ginger.
Oh, he's still here. Night, everybody.
Bye.